Okay. So hello, everyone. I'd like to welcome you all to the second annual New Jersey Youth Transition Conference. Hopefully you've been taking advantage of the other workshops that we've been presenting. We still have tomorrow and Friday, so it's been a wonderful week, and I hope we get to see you again. My name is Dawn Monaco, and I represent the SPAN Parent Advocacy Network on behalf of the YTC Planning Committee. We will place a registration form in the chat box for you to share your contact information so that we can share with you the recordings and the resources of all the workshops. Please note that those of you who are seeking continuing education credits, you are required to complete this form, as this is the contact method we will be using to send you your proof of attendance. Today's workshops will be hosted via the same link that you just joined with today. You can see the full schedule on our website, and we're going to share the agenda on this screen after the conclusion of this workshop. So for this particular workshop, I would like to welcome both, Patricia Brennan and Jessica Licona. They're going to be presenting on the overview of self-directed services in New Jersey, which is a very important topic. So I want to welcome you both. Someone will be sharing their screen, correct? I'm not sure which one of you. Okay, so that's Tricia. Wonderful. So you should have capabilities to do so.
Perfect. I just sent something to Amy to ask if I have the abilities to do so.
I think she's already, made you a co-host.
Perfect.
Yes or no?
Yes. Okay. So let me just pull this up.
Sure. And to the rest of the attendees, we're going to take questions at the end, but you can put them in the chat at any time and we'll address them at the end of the presentation.
Just give me a second here to get myself going. There we go. My meeting is being live. Sorry, I got a pop-up that says it's being live streamed and I'm being recorded, and I had to figure that one out. Okay. So welcome everybody. We're excited to be here. I am Patricia Brennan. I am the director of the Office of Education on Self-Directed Services, the waiting list and special projects at the Division of Developmental Disabilities. I'm here with my assistant director. Jean, go ahead and introduce yourself, if that's okay.
Hi, good afternoon. My name is Jessica Licona, and I am the Assistant Director in the Office of Education with Self-Directed Services.
Hold on, my thing is not, there we go. Sorry. So we have it was announced at the self-directed conference about our new office. We are a brand new function at the Division of Developmental Disabilities because the state saw a need to have people educated on what self-direction is and really enable people to be empowered to have the choice to move forward to self-direct if that's the way that they're looking to go, especially as our system has completely changed into the fee-for-service system. So we are represented statewide. There are staff who are subject matter experts. So you see myself, Jessica, my assistant, Kimberly Jessamine is in our Flanders office, Adam Weir in the Trenton office with me. Christine Jones is also in Flanders. William Billups is also in Trenton, and then Marguerite Lanchambon is in Mays Landing. So you see we have our folks spanning from the top of the state all the way down to the bottom, really trying to make sure that we get to know what resources are out there and really helping out people to make the right decisions, educate them on the value of self-direction, the choice of self-direction, what it means. We're really here to help people and help them through this process. So what are we going to talk about today? Just kind of roll through this next hour you get to spend with us, just to see, we're going to talk a little bit about our new office, who we are, what we do, give you a brief overview of self-direction, talk a little bit about support brokerage, and give you the opportunity to ask questions of us. So I've been starting off almost every presentation that I've done recently with what the division's mission is, just to kind of bring it back home. So at DDD, we assure the opportunity for individuals with developmental disabilities to receive quality services and supports and participate meaningfully in their communities and exercise their rights and make choices. So again, just kind of drilling it home as to what we're here for, what our next steps are, why we're doing this work. We also are part of, in our office and throughout the whole entire state, we are a member state for the community of practice of supporting families, and really trying to drill home that the core belief that all people and their families have the right to live, love, work, play, and pursue their life aspirations in their communities. And again, all meaning all. So a little bit of background on self-direction. New Jersey Division of Developmental Disabilities has been committed to providing people with intellectual and developmental disabilities the choice to self-direct their services for over 20 years. So actually, it started off in the late 90s with the self-determination national movement. And then in 2002, there was a new and improved systems change, which came through. And in that grant, as our state moved forward, a core group of families sat down with us and said, you know what, if you gave us the Medicaid dollars, we could do this better. We could make it work. What meets individually and person-centered for my loved one. So we're not just picking from a menu of services, we're building and creating really awesome lives. And we listened and we started to build from there. And this was prior to fee-for-service. So at that time, the options were contracted or fee-for-service, or self-direction. And now that we moved to fee-for-service, everybody has choices, and if they have going provider managed or making the informed choice of self-direction. Again, the division shifted to a fee-for-service system, so that strengthened our commitment to people having choice and the ability and flexibility and portability. Our office provides a centralized place for the delivery of education and training for people with intellectual and developmental disabilities who are receiving services. Their families, advocates, support coordinators, community partners, and other internal and external stakeholders. Our goal is to really be that hub that has a lasting infrastructure that you can go to and ask questions as we improve upon self-directed services, and also help people in making them informed choices. We are staffed by, you saw our pictures earlier, our subject matter experts on self-directed services, and really to help people live the best lives. Our goal is educating various stakeholders through using some of the tools and benefits and responsibilities of self-direction. We are just starting, and we're super excited to be starting some facilitation of networking meetings for peer and families under the division. So we're really going to be having some really awesome networking meetings for families to share with each other. So those with lived experience to say, hey, what worked for you? Hey, what didn't work for you? Or I'm thinking about self-directing. What do you see the benefits of it are? What, I'm struggling here. Really providing a really great place to have networking sessions. And since we've been virtual, we've been finding them out to be almost a little easier to have attendance, because families are able to just log on. We don't have to, we do lose that personal aspect, but we don't have to worry about parking or any of those types of things. So we're really excited to be facilitating some networking meetings within our new office. We also provide technical assistance for support brokers, including agencies who are seeking to provide the service and people and their families who are seeking to utilize it. We're also going to be engaging in work to integrate information about self-direction all throughout our division service system. So that's just a little bit about our office. So what is self-direction? So you may want to ask, okay, so what is it? So this is actually the national definition. It's an alternative to agency delivered model, which is provider managed. The person, not the provider, has the authority to screen, train, and supervise their own staff and self-directed employees. They have the ability to utilize financial management services agency, the fiscal intermediary, as is known in New Jersey. And New Jersey people can self-direct all or some of their services. Again, we really talk about this as the service system is blooming and changing. So in the past, everyone was coexisting within the context of their family and community. And then we were able to provide services to people. So that was great, but it was almost like you have an intellectual or developmental disability and we had the services, so you go over here. Where truly now, as we are, services are evolving, we are seeing that people should be supported within the context of their community and family with their services and supports peppered throughout. So it's an integration process, and looking at the circle shows how things have evolved over time. Again, it's a paradigm shift. In the past, we saw provider managed services where the professionals were identifying the type of supports that were provided by the organization. In self-direction, the person is actually provided the ability to hire, train, supervise, and access generic community resources. In a provider managed setting, the agency is taking responsibility for employing direct support professionals. Whereas the person, if they're self-directing, is identifying the needs, identifying the preferences, and whatever supports and services they are desiring to have. In a provider managed setting, a professional is determining the support strategies that are implemented by the service providers. In a self-directed setting, the person is directing the support strategies that they want to put in place. So in the self-directed setting, the person is making it has the responsibility to make these choices of who, where, and how they're receiving support. Again, a lot of responsibility goes along with this, but the person is always in the center of every plan. Let's talk a little bit about what can a self-directed employee be hired for. I will have this information will be available to you later on, so I don't have to read all of it to you. It's in our manuals as well. So both the community care program and supports program can hire self-directed employees. You can also utilize services through a community vendor such as assistive technology, environmental modifications, goods and services, natural supports training. A support coordinator can work with the person for the next steps of the housing voucher. People have the choice and the option to use both self-directed and provided managed and mix it together. And some people may choose to self-direct all of their support services. So just to give you an example, we've thrown on a couple of different calendars just so you can see and say, okay, so maybe I want to use what would be known as a traditional provider, but only a couple of days a week, because Mondays and Wednesdays are the days that I really like as we're about to graduate. I really like what's going on at the day program that's close to us on Mondays and Wednesdays. But Tuesdays, the Petals Flower Shop, we have some employment opportunities. So that's what I like to do on Tuesdays. And then maybe Thursdays, volunteering at a children's hospital with the support staff, figuring out having lunch with friends and having a support staff accompany you, that you've chosen the person who is going along with you to the gym, or just purchasing a membership with the goods and services, going dinner and a movie. So figuring all these pieces out, really taking the time and figuring out, okay, so what is it that we want? How do we want to get there? Do we want to be in a provider managed setting where it's 5 days a week, the same type of thing? Or do we want to think a little bit outside the box? Do we want to go some days do one traditional thing, some days do something different? Or do we want to be completely creative and think every day of the week something different that we would potentially be doing? So I'm going to turn it over to Jess to talk a little bit about the fiscal intermediary.
Yes, so like we were talking about, in New Jersey, you can choose to hire some staff to come to work with you in your home. And one of the ways that you can do that is by hiring a direct support staff through a provider agency, or you can hire your own self-directed employee who you choose yourself, and you hire yourself. And the way that you'd be able to hire them on would be through the use of what we call a fiscal intermediary. A fiscal intermediary is one of the things that makes self-direction possible. And it's basically a private company that's contracted to manage payments to your self-directed employees, so they would cut those paychecks. And if you choose to use goods and services vendors in the community with your DDD budget, the fiscal intermediary would also cut the checks and send payment to the goods and services vendors. You can go ahead into the next slide.
Sure.
So, and one of the big responsibilities with self-direction is that you get to make all these great choices yourself. You get to choose the self-directed employee who you want. You get to do that recruitment and pick that right person who's going to come work with you in your home. And maybe you don't like the idea of having a provider just send someone to your house, not of your choosing. So with that comes some responsibility. You guys get to recruit the staff, hire them on. The fiscal intermediary will do a lot of that onboarding paperwork, but that recruitment part and the supervising of the day-to-day of the staff, gets to be part of the responsibilities of the person who is self-directing. And we do have a service in New Jersey called Supports Brokerage that is designed to be that subject matter expert on self-direction and to help families to build these skills of recruiting staff for the first time, training them and hiring them, coordinating schedules, thinking about your circle of support. So that's definitely an option we have. The fiscal intermediary's role, however, is not to do those types of things like supervising of day-to-day. They're really just kind of like payroll and human resources for your self-directed employees. We have two different options for fiscal intermediary in New Jersey, and you get to make that choice based on what works best for you. And the two options are, one is called the vendor fiscal employer agent model, and that is with public partnerships or PPL. And the other option is called our agency with choice model, and that's with Easter Seals. So what are the differences? Here's our two options we have. We have PPL, we have Easter Seals. What's the difference between the two? And there's really three key differences to think about when you're trying to make your choice. The first one is who would be identified as what we call the employer of record. The employer of record is the person who's going to hold that federal employer identification number. So if you are going to work with public partnerships or PPL, the person or their representative would actually need to apply for that employer identification number and act as the EOR if you're going with public partnerships. If you're choosing Easter Seals will act as your employer of record and hold that EIN number. The second big difference is the availability of health benefits. So if you want to offer your self-directed employee health benefits, that's something you can do with Easter Seals, but public partnerships at this time, that's not something that you can offer. If you went with public partnerships, there's possibilities of other ways like the marketplace for them to get health benefits, but right now, public partnerships doesn't offer that to the self-directed employees. And the third big difference is the cost. So with public partner, yep, you can go ahead and switch to the next slide. Actually, that was perfect.
Okay.
So with public partnerships, the state pays the total cost for this program. So you won't see any money coming out of your DDD budget if you choose to use PPL as your fiscal intermediary. With Easter Seals, the state will still pay the same amount that they pay for public partnerships, but there will be additional fees that you'll see coming out of your DDD budget. If you can just switch to the next slide. And this slide, this is our per member per month or PMPM cost table. This sort of outlines the amount of money that would come out of your budget if you chose to go with Easter Seals. And it really just depends on how many SDEs you're hiring, how many hours per week, whether or not you're offering health benefits. And you can see there some examples that could come out monthly and annually. Next slide. So how do you choose? It depends on your needs and preferences, as well as the ability of your budget to support that per member per month cost for participating with the Easter Seals model. But you could discuss these options with your support coordinator. You could even reach out to our unit, the Office of Education and Self-Directed Services, if you wanted to talk more. And there's a ton of stuff on DDD's website, the Division of Developmental Disabilities website. We have all of that information that I shared is up there as well, if you'd like to look further into that. Just like I said, up on our website with DDD, you will find FAQs. You're going to find side-by-side comparisons of both of the fiscal intermediary models. You'll find that cost table for Easter Seals, and you'll even find some additional pre-recorded webinars. And there was our website. And I definitely welcome you to go and read it because it's a lot of information for sure.
Okay, so did I unmute? I'm not muted. Good. Okay, just want to make sure. So there are also additional tools that you can use to think about. So I threw these in here because as you're thinking about graduation, you want to think about, okay, so what am I looking for? What's next? How do I get there? And these tools that we have here, one is called the Integrated Support Star, and you can use it for anything. Jess and I have used it for so many different aspects of planning our strategic team, figuring things out, hiring new staff, but you can put your person who's about to graduate, since we're talking about transitioning, in the middle of the star, and then put their strengths and assets around them and the people who they have strong relationships with. Eligibility specific information also. What else are they eligible for? What types of technology could we use? What community-based activities can we talk about as well? And figuring all those pieces out. And then we can also talk about mapping out the reciprocal roles. So thinking about one of the moms says it best is that, sometimes she just wants to be mom. She doesn't want to be that support staff. She just wants to sit back and be mom. So it's talking about figuring out the difference between caring about and caring for, and figuring out how to get the person to the next step of their life. So as you're thinking, do I want to self-direct? Do I want to go provide and manage? What's next in my life? I just want to make sure you had some of these really awesome Charting the Life Course tools to help you along the way. Additionally, we have this other tool, which is called the trajectory, which is so key in any way. And you don't have to, write it down. You can just start a conversation this way, or have a piece of paper and draw an arrow to it. And many times people have, when you ask them, what do you want? What do you want in your life? Especially about graduation. I know I wasn't sure what I wanted to do when I was about to graduate and transition to a, next step in schooling and figuring things out. But I knew what I didn't want. So a lot of times you can say, what don't you want? What don't you want it to look like? And from there you can build, okay, this is what, so it sounds like this is what I do want. And you can also talk about experiences you had along the way that may not have been good, or experiences you had along the way that may have been awesome and you want to replicate. So you start thinking about, okay, so this is my vision for what I want. Really having these good discussions, because as we're making these empowered choices about, do I want to self-direct? Do I want to be in charge? What do I want next? I want to ask these questions of the graduates as, okay, so what do we want next? What's our next step in our life? And a lot of times they don't know when you ask, especially, graduating is an overwhelming process as well. But people know what they don't want. They know what they don't want to have happen. So that's such a key piece to use this tool. Again, it doesn't have to be the printout. You could be just, a piece of paper with an arrow on it, or you could just do the question. Okay, so then if you don't know what you want, tell me what you don't want. What type of places don't you want to be at? What type of places don't you want to work at? And figuring those things out. Again, this is just another piece of the trajectory, another example. And, I have some ways in which you can get this information as well. But we use this a lot when we're helping people figure out, do they want to self-direct? Do they want to be in the driver's seat? What do they want to do with their self-direction? How do they want to self-direct? Or do we want to go provide or manage? Do we want to have an agency that is just in charge of all these pieces, because it is a lot of work and it is overwhelming and we're not sure what to do next? So what does a support broker do? Support brokers are designed to help people use self-directed supports and services effectively. They're available in both community care program and in the supports program. A supports broker may assist a person or their family and the representative in helping arrange for, planning, assessing, and managing their self-directed budgets, being a responsible employer, figuring out how to recruit staff, how to interview staff, how to select staff, how to hire, how to supervise, how to evaluate staff, understanding the responsibilities involved with self-directing staff, helping a person self-direct their employees, making sure the person and the self-directed employees understands and complies with the rules and regulations associated with self-directed services. Again, a support broker is going to help a person and assist them making their community connections, developing a circle of support, helping them figure out what types of things they may want to do. So they may work with a support coordinator and say, okay, I want to go to, take a class take a certain type of class. But a support broker is going to help them figure out what type of class, where the class is, which one's best. So even if it's joining a book club, figuring out, okay, there are 4 different book clubs in this area. Which one do I want to join? How do I make the right circle of people? Figuring out the person's immediate and long-term needs. And they're going to be working with the family and with the support coordinator in partnership and figure out what connections are best made and where where to kind of get the right self-directed employee, what are the right activities to do, who's the best support staff, figuring all those pieces out. That's something a support broker can help a person do. So again, they're going to perform the employer-related tasks for person. They're not going to, they're not going to perform the employer-related tasks for the person. They're going to be working with the person in general. They're not going to duplicate support coordination services. They're not going to make referrals or connect people with traditional Medicaid providers. They're going to be helping people really think outside the box and help coordinate with their community. And always doing things with the person at their side, or at, knowing exactly what the person wants, helping a person sift through resumes, helping a person with the interviews. They're going to provide all services of support brokerage and no other additional services to a person than support brokerage. Again, sports brokerage is available to all people who are self-directing, not to people who are in a residential license setting. It's for people who are in the self-directed system. You're going to make sure if you're utilizing a support broker that you're incorporating this information into a person's plan, and it's assisting them along the way. Again, support brokerage usually is going in tandem with another service. So they're going to be working with the self-directed employee, they're going to work with the fiscal intermediary. They're working in partnership with everybody so that the person can live their fullest life possible, to have the best access to community supports and services. This is a complete team effort. Everything that is done with self-direction is done as a team. Everyone needs to work together to get the right connections, the right supervision, the working partnership with the fiscal intermediary, with the person, the support coordinator, the family, anybody that they may be looking to hire, to recruit. It's all done together. It takes a lot of responsibility, but it truly gets to the person's desired outcome at the end. So again, a lot of responsibility with the documentation, a lot of responsibility with recruiting, and we have support brokers to help you through all of these pieces, but it does take a lot of work. But getting back to the fact that, families came to us and said, if you gave us the dollars, we could do this better. And really seeing how families can achieve what they're looking for their loved one to do with their lives, especially at the time of graduation. Here are some additional resources. You'll have the ability to kind of have this information because the PowerPoint is being shared. I've been assured that it's being shared. Here is our team, and I am going to stop sharing right now. And I am going to open it up for any questions you may have. You can throw them in the chat. Or you can just raise your hand. I don't know if it's open for raising the hand or not.
Yeah, this is your workshop, however you'd like it to
all right,
go,
so if you
Trish.
want to raise your hand and ask questions, I'm more than happy to answer questions that way, or you can type them in the chat. I see a couple have already typed some.
I have a question that came through on my end to the chat. Dawn is your host for this workshop. She may also have some, and you both may also have them in your chat. You might want to check. The one that came through to me is asking, can a support broker help to find housing?
Support brokers aren't typically helping to find housing, but they will help you find the different areas in which figuring out where you want to live and building those community connections. They're going to help you figure out, okay, so what type of a location do I want to live in? How do I get there? Help you figure out, is this the right neighborhood for me? They're going to help figure out the circles of supports. So anybody who is looking to have a new house, you're going to need, they would be looking to figure out if this is the right neighborhood for me, if this is the right place. That's something a support broker can help with.
Thanks, Trish.
So offline, I was talking to Amy. This is Dawn, the host.
Hi.
Hi. I was talking to her about, because I have a 24-year-old son who has DDD services, and we have one self-directed employee. The rest are job coaches through an agency, but we have one who takes my son out on the weekends. You have that interactive map where you can find other self-directed employees, which I think is a great tool. There's not that many SDEs on there, and I know the last time I attended a workshop, they said they were really going to try to get that more SDEs on there. How do people find self-directed employees? Because I agree, it is, I can manage it, so it is a great way to utilize support for my son. But where would you find other SDEs?
So I'm gonna just, talk freely with all of you, some different things that I've seen along the way. So some families have figured out, utilizing, they've put ads out, as well as just sometimes it's just word of mouth, finding other siblings, friends. But I know there was one, and I'm gonna tell some stories of, because of their experiences I've had, lived experiences I've had along the way, but there was one mom, and her neighbor's husband had recently retired, and her neighbor was saying she needed something for her husband to do, and her husband was friendly with her son, and she just hired him on because they hired him to take him to go to the gym together. So they were, you can find different people in different places. There's another mom that I was talking to, and she said that when she takes her son out, when he goes out with other SDEs or with other friends, he has his own business card. So that if there is somebody who says, like hang out with me sometime, he has the business card and says, hey, maybe you're going to work with me, but he has his own business card, and they figure it out that way. So it's a lot of, networking amongst your friends, asking people, putting flyers up at local colleges, internship programs, just figuring those pieces out. I know it is definitely a difficult task to find the right fit, but once people do find the right fit, they find, staff tend to have a really good, shared interest with somebody, and it works out really well.
I agree. I think it's wonderful. This is the barrier that I've, aside from having to go out and find them on our own, which is fine. The woman that I found on my own, but it's kind of a double-edged sword in that they have to go through a lot of training, which you want them to go through, but it's kind of difficult to find people who are willing to spend the time on that training. And, so it's kind of a double-edged sword, but overall, I do think it's a good process because, as I mentioned, it's something that I can manage. It's someone I trust. I know them. I found them myself. So I can see why people would gravitate to that process.
I have another question in the chat for you ladies. What is the maximum that an SDE can charge for a service?
They need to follow the actual rates that are in our manual. It needs to all comport with the manual.
Is there a general guideline or frame?
Yeah, I will pop that in the chat when I get the manual guidelines up. I'm just going to make sure I have the exact right information for you. It's typically a $25 an hour cap, though. Yeah. Any other questions? We do have a helpline, a help desk, our Office of Education and Self-Directed Services help desk. So you can feel free to write into our information, and we will answer those questions at any time. We have a different member of our staff is on it each day, and they respond pretty promptly.
No more questions? Anyone? You have them here. You'll never have them right in front of you again.
I have a question. It's Amy. I'm wondering where the inspiration came from in creating this new office with DDD for education on self-direction.
So that came from a group of advocates, actually. So there was a strong group of advocates. So there was an actual before we moved to the fee-for-service system, there was a focus on self-direction, and there was an actual unit. But since the time period that we moved, the energies were put on moving everything to fee for service and everybody having choice, but there wasn't as much of an educational shift to what it really means to self-directed. Everyone has choices, fee for service. In not June 22, June 21. So June 2021, there was a group of advocates who talked to the assistant commissioner, and they talked to the ombudsman. They talked to quite a bunch of people saying that they really need to get back to some of the roots of the education of people, so that as they're about to graduate, they know exactly what it is. So people, as you're in middle life, you know that you have the ability to pick and choose and supports and services, and what that means. Doesn't mean I'm not happy with my provider, I need to go find another provider. As we said before, families, have said to us, I was at that table in 2002, and families said to us, if you gave us the dollars, we could do it better. Help us, let us help you build this. And we did. So there was that group of those families who said, we used to have networking meetings. We used to talk to each other all the time. We used to be able to share, this is what worked for me. This is how I found my employees. This is what didn't work for me. This is how I fired my employees. And we didn't have that anymore. And because of that, there was a strong impetus from the department to have this office of subject matter experts who are able to educate people in all stages of their life. As we are already, both Jessica and I are community of practice for supporting families ambassadors. I'm the team lead for the state of New Jersey. We partner with the DD Council on FOGS for this grant. So we said, we really want to make sure that people were getting the lives they want, not just getting lives, getting good, rich lives in the community. So figuring out like their whys and the next steps. So that's how it grew. And we had to sit down and plan like how it was part of the waiting list, because in the early phases of self-direction, it was through governor's initiatives. And so that was through the waiting list, and we already were the waiting list unit. So it just is a natural fold for us. And we've been growing it along the way, and we're trying to figure out what next, how to make sure that it grows, and how to make sure that we implement best practices in self-direction as it grows across the nation. So we've been really trying to, both Jessica and I have been really trying to make sure that we see where the barriers are right now. Like sitting back this first bit since the end of February when it was announced, we sat back and listened. That was all we did throughout the summer, I think, was just listen to families say what's not working, what's really working, they wish they had more of, what they wish was different, and trying to figure out, okay, so what are the national trends for that? What's worked for other states, what hasn't worked for other states, and how can we enhance New Jersey system? So that's a really long-winded answer to your question, Amy, but that was why we thought the really intense need for this office, and so that people can write in and ask questions if they have it about self-direction, and say like, hey, I'm not, so it's for families, for support coordinators, it's for whoever, and if we don't have the answers, we will get them for you. Again, apologies, really long-winded answer, but
no, that's so helpful to know. Thank you.
And we are here for anybody who is about to graduate, and we partnered with the folks in our planning for adult life unit to say like, this is what's next. Here's some of your choices. Here's how we can help guide you. Figuring it out, sitting down with that trajectory, figuring out the integrated support star. Is this what you're looking for? Is this right for me? And moving towards next steps.
I have a question just came through to me through the chat. Do you need a support coordinator for the self-direction model? Yes. I know that you need one for agency delivered model.
For everybody in our system has a support coordinator. So there's no longer case managers. As soon as you move through to our system, you will pick your support coordination agency. You don't have to have a support broker. In some states you do, but in New Jersey, you don't have to have a support broker. You can choose to manage all those pieces yourself, but it's an option that's made available to you.
Okay, next question is, what is the difference between support coordinator and support broker?
So again, I kind of gloss over this. A support coordinator is going to be the person who really writes your plan. They figure out what services and support you're looking to receive. A support broker is going to be the person who helps you get that first look at the place you might want to get the service from, figuring out what type of service, where you would want to go. They're going to help you figure out. So you may say, I want to have a self-directed employee. Your support coordinator can put that in a plan, but your support broker is going to help you advertise for the self-directed employee. They're going to help you sort through all the resumes you may get back. They're going to help guide you through the interview process. If that's something you want them to do, you can create whatever it is you want them to do to help you through that next step. The support coordinator is going to write your plan so that your services and supports get implemented and through the waiver. Does that distinction? There is a side-by-side on our website that you can see the difference. But I think that kind of, really, the difference is really that the support brokers and support coordinator are working hand in hand. But one is writing the plan, making sure all the services and supports are in there so that they can pay and build. The other one's helping you figure out who's going to be the service provider. What type of self-directed employee I want to hire, where I want to get them from, what type of goods and service I want to use, where do I want to go in the community, what type of activity do I want my self-directed employee to go on, those types of things.
Thanks, Trish. Next question says, I think you answered this, but the support broker comes out of my budget, like my son's budget rather, that, and the support coordinator does too, or no?
Support coordinator does not come out of the budget. The support broker is a choice that you can utilize. So that comes out of the budget. Yes. Support coordinator is assigned upon graduate, the April before graduation.
I think maybe you have to have a support coordinator. You don't have to have a support.
Correct.
The support coordinator kind of coordinates everything, all the services.
And a supports broker is a service.
Yes, that's included in the plan that the support coordinator has to put together. Yep. It can be confusing, but. Anyone else? We do have some time, but if you don't have any questions, I guess we would end early.
I thank you all for attending and listening to us, and I encourage you to ask us, right into our chat if you have additional questions.
And this, as we mentioned, this is being recorded and you'll receive this as well as, so first off, before I say that, let me just thank Patricia and Jessica for being with us today. Thank you so much. And I think there's a lot of information and there may be not too many questions because they have to digest it all first and then they'll have questions later. So, but that's okay. So as I mentioned, it's being recorded. It's going to be available on our website in November for those in need of the proof of attendance for continuing education credits. You will receive an email soon with your certificate. Again, it's up to your employer to accept this as proof of continuing education. And you will not receive that certificate if you did not register using the form that we shared. Of course, if you ever have any questions, you can reach out to us at njyouthtransition@gmail.com. Again, thank you both for being with us. There's a lot of information that's definitely needed. So thank you so much.
Before you go, thank you. One more question came through when Dawn was speaking. Can you, how do we contact you by phone or email?
And the
in your
email
office?
is the OESD DDD OESDS email, and it's on that PowerPoint.
Okay, are you able to put it in the chat for folks that might want to reach out today? Because we won't be able to share the materials for
All right,
a
Jess, can
while.
you put it in the chat? Thanks.
Absolutely.
Thanks, ladies. It's been great seeing you today. Thank you for being here. So excited about the new office.
We are too.
All right, there you go. Thank you.
Thank you.
Getting lots of thanks also in my chat from
Awesome.
attendees. So thank you. Have a great day.
Bye-bye.